Welcome back to Physio Vibes. In this video we are going to look at
thoracic outlet syndrome and physiotherapy management.
Before we start, hit the subscribe button for more videos. Press the bell icon and never miss another update.
Thoracic outlet syndrome and physiotherapy management. Thoracic outlet is a space between the first rib, clavicle and the scalene muscles. The space at the thoracic outlet, or inlet when it is less than adequate, subjects the neurovascular structures seeking to gain entry into the upper limbs via this space. This syndrome results from the compression of neurovascular bundle comprising of subclavian artery and vein, axillary artery and vein, and brachial plexus at the thoracic outlet. The above structures are liable to be compressed. When this space gets narrowed either due to hypertrophy of the existing muscles or due to any other cause like congenital, trauma, etc. Anatomy of the thoracic outlet. Sites of compression. The sites of compression could be either supraclavicular, subclavicular or infraclavicular. Supraclavicular interscalene triangle between the anterior scalene muscles. Subclavicular interval between the second thoracic rib, clavicle and subclavius. Infraclavicular beneath an enclosure formed by the coracoid process, pectoralis minor, and costocoracoid membrane. Clinical presentation. Classical feature of the thoracic outlet syndrome is nocturnal appearance of pins and needles in the fingers which disappear when the patient changes position or sits up. The symptoms reappear on elevation of arms overhead or on elevating the scapulae. When the space between the clavicle and the first rib is reduced, these symptoms occur. Investigations. X-ray to rule out intrinsic causes like cervical spondylosis, cervical rib, etc. Nerve conduction studies. Difficult to determine the nerve conduction velocity through the thoracic outlet, but its biggest value is to rule out problems like entrapment, for example ulnar nerve at elbow, wrist, etc. Treatment. Conservative treatment consists of rest, physiotherapy, exercises like shoulder shrugging, etc. Surgical treatment. Indications: gangrene and post-stenotic dilatation. Methods. Removal of the first thoracic rib. This is the most effective treatment as it deals with both supraclavicular and infraclavicular etiological factors in this syndrome. Removal of cervical rib. If this is the cause of compression, scalenotomy is indicated in scalenoxanticus syndrome. Physiotherapy measures for thoracic outlet syndrome. Thermotherapy for pain relief, relaxation. Correction of posture by postural guidance. Exercises to improve distal circulation of hand fingers. Exercises to improve tone, power, endurance of whole arm small muscles in hand, particularly strengthening exercises for all shoulder joint muscles. Self-resisted strengthening exercises for shoulder elevation adduction muscles. Progressive resistance exercise for shoulder girdle with weight belt. Exercises for thoracic outlet syndrome.
Thanks for watching. Don't forget like, share and subscribe.